What is spinal stenosis? Hey everybody, this is Mike Erlob with another episode of Power Your Life. So it is so awesome, it's so amazing to be here with you guys again. Today we're going to talk about a super exciting subject of spinal stenosis. So, this is a real problem for many people. And it really can limit your ability. If you have suffered from spinal stenosis, if you know somebody who has, it can really limit your ability to just function in daily life. I mean, we're talking when you have spinal stenosis, it limits your walking, it really limits your standing. It really creates problems for you as far as how far you can walk. The only way most of people who have this can find relief is when they sit down. And then the minute they stand up, standing in long lines at the grocery store, going grocery shopping, going shopping in the community, going for hikes, mowing the yard, you name it. If it involves standing or walking for any length of time of more than, 10 or 15 minutes, those with spinal stenosis have a real problem doing that because the pain just gets to be so intense, they have no choice but to sit down. Now, it usually affects those over the age of 55, but I've seen it occur in those that are younger too. I've seen spinal stenosis in those under the age of 50. So, it isn't just one of those things that happens to us as we get older, and it is not a normal part of aging. It just happens to hit that population a little bit more frequently. One of the things to look for, and this is one of the questions I ask my clients when I suspect that they may have spinal stenosis, is I call it the grocery store sign. And what the grocery store sign is it's when you're going grocery shopping and it hurts so much to stand upright and walk, but you feel so much better when you're pushing the cart. And you may have experienced that. You have that really deep ache, pain in the center of the back. And the minute you get a grocery cart and you kind of lean over on it a little bit, the pain goes right away. And, that is a classic hallmark sign of spinal stenosis. So if you're having that problem, when you go grocery shopping and you feel better when you push the cart because it takes pressure off of your back, you may have early spinal stenosis. Now, the problem is this will start to make you feel older than what your age really is because, if you can't stand upright, if you can't walk for any length of any distance or be on your feet for more than, 10 minutes, it really makes you feel limited. It makes you feel older than your years are. And it's really extremely frustrating because it really starts to take away your independence. You start feeling like that you're losing your ability to just take care of yourself. Not to mention the limitations that it can cause with things like brushing your teeth or stooping over the sink when you're trying to shave. Those things that I'm telling you, we take that for granted. Last year, I went through a biceps rupture on my right arm and had to have surgery and was locked up in a cast from my fingers all the way to my shoulder, and I'm right-handed. You take for granted things like brushing your teeth, shaving, putting in your contacts in the morning, some of those basic self-care type of things, flossing your teeth. And, when you can't do it, it's frustrating. It really makes you feel like you can't take care of yourself. So what exactly is spinal stenosis? Well, we're going to talk about that, and we're going to take our little spine, a handy-dandy spine model here. And what it is spinal stenosis is when the area of your spine where your spinal cord is and the nerves that are traveling between the areas that come out, it's when that gets compressed due to too much bone that's growing in the area. So what I'm talking about is if we're looking at your lower back, and this is a back view of the spine, and we open it up here, we separate those vertebrae, this is where your spinal cord is, and then off to the side here is where the nerve comes off. And what happens is this space in here or the space around the spinal cord, the canal, you get too much bone that starts to grow. So like these joints right here, they'll start to become arthritic, and you'll start getting these bone spurs that will start growing, and then they'll get bigger and bigger, and then eventually they'll just crowd into that space. And you know, it's kind of like when you're packing a gym bag for an overnight trip, and you just cram too many clothes into the bag, and you can't zip up the bag. You see, spinal stenosis is just like that, except for the space in here and in here, where this nerve and the spinal cord is, there's just not enough room anymore. That bone has started to grow and started to pinch off. So then when you are standing upright, which then pushes the spine into this more of an extended position, meaning it pushes it, you know, more back, which is a position that the spine goes into when you're standing and walking. That compression even pinches even more. And that's why it feels better when you sit down, because then when you sit down, it actually opens up the spine and takes pressure off of it. So, you know, that bony overgrowth, you know, you can't, unless you go in there surgically and remove that, you can't necessarily get that to just resolve. However, what happens is in that spinal cord area and around the nerve where that bone spur is, you know, that triggers inflammation. And that inflammation causes swelling of the tissue, and including the nerve, which then creates further compression. And so the real problem here is, yes, it's a mechanical compression, but it's the inflammation and swelling that occurs from that, and the compression of the nerve and the subsequent pain that sets off, that becomes a real problem. And the even bigger problem with spinal stenosis is not so much, hey, I've got extra bone growing here, but the question is, why is that happening? You know, why is the body all of a sudden deciding to grow more bone into that area and narrow the space around the spinal cord and around the nerve root? You know, why is that happening? And you see, the reason that occurs is because your body is going to grow more bone in areas that are being stressed too much. So if you're not taking care of the rest of the back, and there is a lot of stress that is being put on the spine itself, then your body protects the joints because it knows that the stress is harmful. So it tries to stiffen the area to stabilize it by growing more bone and calcium deposits. And then the result is, over time, is you start to get spinal stenosis. Now, the real problem here are the forces and the stress that to the spine that caused this to happen in the beginning. So if you want to improve the condition, if you want to reverse the pain that you get with spinal stenosis, or even keep it from happening in the first place, you have to attack the real cause. And that real cause of the stenosis is the imbalances in the body that have been created by too much sitting, repetitive movements and job tasks, and even past injuries. And then the subsequent, the chronic inflammation in the body that also occurs. And also, what you eat has a very large impact in your inflammatory levels in the body, which then can also create issues with the spinal stenosis too, because if there's chronic inflammation around the nerve root and in that joint, your body's going to sense that, and it's going to start laying more bone down to stabilize it. So what imbalances are we talking about that are impacting the spinal stenosis? What we're talking about is, we're talking about your tight hip flexors. All right, so here's your pelvis, your femurs come off of here, and you have these muscles that come off the spine that then come down through the front, and they actually fill in with another muscle here in your pelvis, and then that attaches to the femur. And we call that the psoas, and then down here it's called the iliopsoas, and then that is what allows the leg to come up or to flex. Now the other is, the opposite side is your gluteal muscles. So your buttocks, you see, they get weak. And that's another imbalance. So when your gluteal muscles get weak, combined with your hyperactive, tight hip flexors, that's going to create more compression to the spine because the psoas muscle is going to create a pull in this front direction, which causes that back to want to extend and then jams all those joints together. The other portion, other imbalance that needs to be considered is the hips. And so your femur fits in right here, and you have to imagine the leg coming off there. But your hip joint, if that starts to get tight, because guess what? Guess what your psoas or your hip flexor attaches to? Your femur. And femur goes right into the hip joint. So if we get tight here, that's going to limit the amount of movement of your hip itself. So that's going to affect when you bend over and you pick things up, and that's going to affect how you walk, which is going to translate to more stress right on that spine. And then the last is if we start getting weak lower abdominals. So your abdominal muscles are divided into an upper and lower half, and we're talking about the lower half. These are the ones that create this like corset around the spine to decompress it and create this feeling of support and structural support, because your spine is meant for just stabilizing, but it's not meant to absorb all of the stress. Your muscles are designed to do that. And so we talked just now about the psoas or hip flexor and how that creates compression. That creates weakening of your gluteal muscles. We tend to call that the disappearing butt syndrome. And you see where folks are losing the muscle tissue in their rear end. They're literally losing their butts. Now, that muscle itself is designed to stabilize the spine and stabilize the back. And when it gets weak, then your overpowering hip flexors will create more of that compression. Now, the tight hips, we just talked about how that lack of motion in there because the psoas or hip flexor muscle is locking it up. And so now when you bend over, instead of the movement occurring at the hip, now all of that movement starts to occur at the spine. So instead of the hips moving, now the spine is, and that's going to create increased stress. So how does this even happen? How does the psoas muscle, which is coming off of here, the hip flexor, even create this situation? And that's where I'm going to get my other model. And let me slide right over here and grab him. But Billy Bob. So Billy Bob. So we talked about the psoas coming off of the front, and it attaches to the femur. Now, when you sit, and we put you in a sitting position like that, imagine that there's a muscle, coming off of here and attaches right here to the bone. So when I'm standing up, that muscle's stretched out, but when I'm sitting down, now that muscle's shortened. So if I'm sitting a lot, that muscle starts to, the hip flexor adaptively shortens. So if we bring it up like he's sitting, it will adaptively shorten. And then it'll start to shrink down to the point where it wants to stay like that. And, it's the same thing goes with bending, twisting, and pivoting. If you're using these same muscles again and again and again in the same movements again and again and again, that creates a stiffening and a loss of motion. And then that creates tightness and weakness, which then creates that imbalances. So what can you do? Okay, so what can you do at home to fix this problem, to avoid it from even happening in the first place? And the first thing that you can do is start working on those 4 areas. Okay, just pick one of them to start with. Start working on loosening up your hip flexors. Once you start doing that, just do a couple of exercises to start loosening up your hip. Even as simple as trying to put your foot on top, like the right foot on top of the left knee. I call that the figure 4 position. Just working on getting into a sitting where you can sit in that kind of a position and stretch your hip out for 10 or 15 seconds 2 to 3 times a day will make a difference. Start strengthening the gluteal muscles. Start working on the buttocks. and then start working on those lower abdominals. So, you just start hitting all 4 of those areas of the imbalances, but you don't have to do them all at one time. I don't want you guys to get overwhelmed. I don't want you to think, oh my gosh, I don't know what to do. And then you hit, analysis paralysis and you don't do anything at all. Just pick one of them and just start working on it. The next thing that you should do is you really should take a look at your diet. Take a look at what you're feeding yourself and focus on making a few key changes to what we call alkalize your diet. And an alkalize just means that you're making your diet so the effects on your body are less acidic. Now you might ask, well, I don't know what makes my body acidic. Well, I'm going to tell you, okay? And these are such minor changes, almost anybody can make them, and they'll have an immediate impact in how your body heals, how it reduces inflammation, and how you can avoid getting into these situations as you get older. So one of the changes you can make is cut out sugar, okay? Cut out or reduce, but decrease your sugar intake. And I'm talking also decreasing your carb intake too. Stop eating so much bread and pastries and stay away from those things because they go into the body, they become sugar, and they make the inflammation in your body worse. Stay away from processed foods. If it's something you're taking out of a box, it's probably not good for you. Okay, so focus on whole foods. Focus on those things that, I tell a lot of my patients, listen, if it doesn't rot, don't eat it. Okay, that's just plain and simple. And when my kids were younger, we made the mistake of letting them eat too much McDonald's. That was easy at the time, especially when they were really young. Go through the drive-thru and you get them some chicken nuggets and fries. Well, the wake-up call that I had was one day I was cleaning out, and you know how little kids are. You know how, when they're 2, 3, 4 years old, they just trash the back of the car. You end up with stuff everywhere, and you got to clean it out regularly. And I remember I was cleaning out the back of the car, one day, and we hadn't been to McDonald's in probably 4 months, and I'm cleaning out and I find some fries, and then I find a chicken nugget, and they're like hard as a rock, and there isn't any mold at all on either one of them. And I'm thinking, wait a minute here, okay, French fries and chicken nuggets, and they haven't molded, and they've been in the back of the car, and they haven't started to stink or anything, man, that's a problem. You want to talk about processed foods with a ton of preservatives and additives. Imagine what that's doing to your body. So reduce that. The other is cut out or reduce the amount of dairy intake, especially milk, okay? Now, I know if you might be using yogurt for the probiotics, there's even yogurt can have a very high sugar value to it. Think about, if you want those probiotics, think about just buying probiotics instead of trying to get it just from the dairy. You can always supplement your calcium, but dairy, as we get older, it really can have a negative impact on your body. Also, drink only water, coffee, or tea. Stay away from pop. Stay away from the juices and things which are flavored. Just stick with water, coffee, or tea. And also, eat more veggies and less meat. I hate to say it, but my mom and my grandma were right, okay? Eat your vegetables. Really, when you look at your plate, 80% of the plate should be a vegetable source and only 20% should be meat. If you just make a few of those key changes, that will help reduce your body's inflammation levels. And in turn, that's going to help you reduce pain. That'll help reduce the wear and tear at the spine, which then can reduce the effects of that spinal stenosis or even keep that from happening in the first place. And even with some of those dietary changes, that'll help you lose a few pounds too. So, that's just an added benefit. But just because you have spinal stenosis, it doesn't mean all is lost, okay? I don't want you to give up. There's hope, because if you can address these imbalances and make some of these key changes, I'm telling you, you do this and you will start to see some positive changes in how your body feels. By the way, I just wanted to let you know, I do have a new ebook that's out, and it's entitled "The 5 Best Kept Secrets to Fast Back Pain Relief." And you can get your free copy just by emailing me at mike@flex-pt.com, or you can message me on through our Facebook Messenger app. So definitely think about picking that up. There's a lot of really good stuff in there. It'll definitely help you. And at this point, I'd like to leave you with this quote from Norman Vincent Peale. And the quote says, "Fear is strong, but faith is stronger yet." Fear is strong, but faith is stronger yet. So I'll let you chew on that one for a while. And until next time, power your life and keep moving forward.